Hey, Dr. Derek Nielsen here, owner of Kaizen Physical Therapy. Today I want to talk about how to get out of pain. Specifically, I want to talk about, I had a patient come in the other day and he had low back pain and he said, "What technique do you use?" And I said, "I use physical therapy." And he said, No, what technique do you use in physical therapy? Because right now I'm getting Graston. And I said, it's not so much about the technique. You know, that's the small picture. What we need to do is get the big picture right. What I mean by that is, we need to look at movement, so we need to look at head to toe movement. There's a certain degree that your neck should move up, down, left, right. Your shoulders should move, rotate, up overhead, go back behind you. There's a certain degree your spine should rotate, go forward, go backwards, your hips, so on and so forth. It's not about the technique, it's about knowing movement. So we look at individualized movement for each individual joint, but then on top of that what we need to do is say, okay, what movement is painful? So for instance, let's say this gentleman, he was having pain with squatting. So not only is every joint supposed to move a certain degree by itself, but then we also have to know the relationship of that joint when it comes to each movement. So the painful movement of squatting, we have to look at the ankles, which are required for squatting. We have to look at the hips, and we have to look at the back, and then we have to know there's some form of stability that's required for squatting. So we look at the painful movement pattern, we break it down, and figure out what isn't working the way it should. The technique is is part of the equation, but it's so far down the line that we need to get the big picture right. So I'm going to urge you that if you're asking somebody in rehabilitation what technique to use, I would say ask them, do you look at full body movement? And do you know how to break down the painful movement? So for this gentleman it was squatting. Do you know how to break down a squat and know each individual part, each individual portion, body part, and where it plays a role within that squat? That's where you're going to find out the big picture of things, and if your rehabilitation expert actually knows movement. That's the long-term goal to getting out of pain, is full body movement. If you want another tip like this, what I'll give to you, if you click the link below, I'll give you my 3 secrets to getting out of pain. Thanks so much.